Hi, Ron.
Hello, how are you?
Good, thank you. And you?
Great, great. So I need to 17, okay. So, okay. Use lecture. Okay, there we go. Okay, well, it looks like we still have participants joining, and we just okay. We are going to get started with our monthly regular informational webinar for Mexico Bariatric Center. And we are very excited as we are celebrating our 10 years helping people. We have helped over 20,000 people change their lives. And we are very excited about celebrating our 10 years anniversary. Since pandemic, we have titled our webinar Collision of Two Pandemics, which is COVID-19 and obesity. Today, our webinar is presented by myself. My name is Ron Ellie. I'm the founder of Mexico Bariatric Center, MBC, and one of our distinguished doctors, surgeons in Mexico, Dr. Jesus Ceja. We have a pleasure to have him with us. And wanted to thank you, everyone who's tuning in today and taking time to share this information with us. If you have not filled out a health questionnaire, please go ahead and do so and select Dr. Jesus Ceja as your surgeon of your choice. If you have submitted a health questionnaire, you need to change your name to Dr. Ceja, and you have to be present to the end of this presentation. And that's when we do the raffle for $2,000 off of surgery. And we would announce that at the end. Of course, if you have questions throughout our presentation, you can use your Q&A tab to enter the question, and we would try to answer all the questions at the end of the presentation. And we try to cover as much as questions that we think that is generally asked during our presentation. So please pay attention so we don't have to repeat the same question. Our topics today is about obesity, risks of being obese and overweight, weight loss surgery in Mexico, what does MDC do and how we can help you. As I mentioned, we are celebrating our 10 years anniversary, and Dr. Ceja will take over and will talk about bariatric surgery options. And at the end, we will have a Q&A answer, and we do the rest. Usually, we take about 1.5 hours, or sometimes close to 2 hours for a webinar. However, today we're trying to go over things faster so we can get it done hopefully before an hour and get everybody back to their normal life. Obesity is defined as equation or formula that you enter your height and weight and you get a number, and that number determines where you are in the chart. If you're below 30, you're normal or overweight, and after 30 you start getting to the obesity, and then after that it will be super obese, morbidly obese, and so on and so on. Obesity is a chronic disease, and it's continuing to grow around the world, including the US. Human being is not used to the fast food, high calorie food, sugary food, and lack of physical activity, and that's why obesity is catching up with us. Of course, all the genetic predisposition we have, the environmental we grow in, like we talked about, lack of physical activity, stress, inadequate sleep, weight gain, drugs, all contributing to this problem. One thing we need to know about fat cells or adipose tissue is when we gain weight, not only they're increased in size, they change their structure and they multiply, so the numbers increase. And the structure change and all these are contributing to problem with diabetes and insensitivity to leptin, to therapies, to vaccination. It is caused by structural change in the adipose tissues. Obesity is impacting 40% adults in the US alone. Of course, as we said, this is a global problem. They have major risk factors. One animation that I like to present here is when we gain weight, what happens to our lungs and our breathing. As you see, that's one of the problems we encounter when we gain weight is our breathing problem. And of course, cardiovascular disease, impaired immune system, blood clot. And when COVID hit, that was a breeding ground for COVID virus, and they would attach themselves to the fat cells. And then you had more fat cells, there was more possibility of catching COVID and getting affected by it. Obese patients, of course, this is the statistics from COVID time, 113% more likely to end up in the hospital, 74% more likely to end up in the ICU, and 48% more likely to die. Of course, the pandemic itself did not help. And the question is, how do we cure this problem? And then, to get rid of all the comorbidities and not be susceptible to viruses like COVID. So, of course, the first thing that comes to mind is diet, exercise, behavioral changes. These are not long-term. Only 5% of people who do this can maintain their weight loss. Of course, drugs and pharmaceutical, which they're really pushing right now, and that also has a 6 to 9% long-term effect. And of course, there are some hormonal problems with that I'm not going to go into. So the solution that is presently available to all of us is bariatrics. Bariatrics is a quick, safe, proven, and long-term solution to get rid of obesity. Bariatrics is like a magic. You know, the minute you get the surgery, your body get a metabolic reset. So what happens is the interaction between your brain and your gut hormones changes. The figure on my right of the screen shows a person with a 250 pounds that, as you see, their brain thermostat or their metabolic thermostat is set at that weight. So if that person goes through extreme diet and extreme exercise, and we talk about boot camp type of exercise, and lose 75 pounds, the brain still sees that person, the metabolic thermostat still sees that person at 250 pounds. So what is it going to do is trying to make you eat more, and it lowers your metabolism. Whereas when you get the bariatric surgery, when you wake up, your metabolic thermostat is changed and it's back to 175. So what's going to happen is you not be as hungry and your metabolism goes up. For people who are uninsured, underinsured, of course, this is the criteria for US. In Canada, for example, people who have to wait a long time to get this life-changing procedure. Medical tourism comes to rescue. This is the last resort. Medical tourism basically provide the VIP treatment at affordable prices. So you can pay out of pocket and get this life-changing procedure. Mexico Bariatric Center has been in the forefront of medical tourism, and we are one of the major centers in the world right now. And we are a US corporation that our headquarters is located in Sacramento, California. And our mission since the beginning has been to provide high quality weight loss procedures in Mexico that people can afford. We have the volume and experience to provide this lifelong care for you and support and make you be successful, get a second chance in life. A little bit about us. Like I mentioned, we've been over 10 years in this space. We have performed 20,000 plus successful bariatric procedures, and we work with seven top quality bariatric surgical teams in Mexico. Our process is very streamlined and very simple. 1, 2, 3. You do the HQ, you get your surgery approved, you pay the deposit, you get on the calendar, you finish your travel arrangement, whether you fly or drive, you start working with a nutritionist, and you be on your way to be on the losing edge. Our all-inclusive packages, which is very popular, covers the surgeon fee, the hotel nights, hospital nights, pre-op, post-op diets, tests, and medications. Of course, hospital fee, nutrition support, aftercare support, and private transportation. Our nights at the hotel and hospital, it depends on the procedure you receive. For popular gastric sleeve or VSG, we cover 2 nights in the hospital and 1 night in the hotel. this is really a good time to take an action. You know, people try to, you know, we are all busy with our life, day-to-day life. You know, you have to make time to get this procedure and change your life once forever. We can always, you know, deal with other issues in our life and make an excuse like, well, I don't have time now. But I think the best time to get this procedure is now. Since pandemic with COVID, we've been putting procedures and processes in place to make even our operation more successful. We do have a support group for aftercare that patients are interacting in a closed support group and they get real-time support. We do have affiliates out there. There are just 4 of them. Kelly, Sarita, Rena, and Judy. These are the 4 of them that they are actually doing some podcasts that you can listen to and tune into. Our drivers are professional. They've been working with us for years and they know what they're doing. You're in good hands when they pick you up from the San Diego to take you to Tijuana. This is the top 7 surgeons in Mexico that are working with us. Dr. Miguel Montalvo, Dr. Luisiana Valenzuela, Alejandro Gutierrez, Rodriguez Lopez, Dr. Jacqueline Osuna. Osuna is working basically part-time in Tijuana and part-time in Guadalajara, half-time. And Dr. Jesus Ceja, which has, we have a pleasure to have him in our presentation today. MBC support system is very unique in this medical tourism industry. As you see, patient is going through what we call a surgeon liaison, which is a bilingual doctor that sits between the health questionnaires submitted and the surgeons and make sure everything is going back and forth correctly. Of course, you have the certified nutritionist and the patient coordinator on the side to help you. The pre-op diet is determined by the by your BMI. For lower BMI, maybe about 30 to 35, you only need the 2-day clear liquid. And then it goes from there to be 1 week and 2 weeks and 3 weeks. It's a very simple, high, low calorie, high protein diet. We work with Hyatt and Fairfield in Tijuana, and we take you on the day your arrival, do the test. We get you to the hotel to rest. The next day, we take you to hospital and we do the procedure. We do multiple leak tests and make sure everything is okay before we release you from the hospital. You fly home when we bring you back to San Diego or drive back home. One of the major success reasons for our success is our surgeon's load management, which means we only do so many surgeries per surgeon per day. And that, in combination with our expertise at the hospital and the surgeons, has made our complication rate to be less than 1%. We do offer a wide range of procedures, whether it's laparoscopic or endoscopic. As you see, we do sleeve, VSG, mini sleeve, RNY, duodenal switch, revisional surgeries, even reversal surgeries. And on the endoscopic spectrum, we can do gastric balloon, endosleeve, which is ESG, and revision of a bypass endoscopically. We do pretty much from 16 to 65 age and anything more than 30 BMI, except for endoscopic procedures. I'm going to introduce Dr. Ceja. He's one of the most educated and most skilled surgeons we have. He came from, he worked in Guadalajara and he joined us years ago. And now I'm going to let him take over if he can introduce himself and also then start going over the procedures that we offer. Dr. Ceja, please take over. Thank you.
Thank you. Hello, everybody. I talk about with you the bariatric surgery. First, gastric sleeve surgery is the most important because it's the most common surgery I practice in Tijuana, in Mexico, bariatrics. The gastric sleeve surgery removes approximately 80% of your stomach using a one in case the single incision, or most common 5 incisions. This procedure utilizes a restriction to change the gut hormones that cause hunger and satiety. What is the pros in question? The gastric sleeve can be easily revised if needed. In compared with the gastric bypass is the similar results, but in this case, in compared with the gastric bypass, with the gastric sleeve, maybe you can develop in the future acid reflux. It's a surgery not reversible. Approximately you can lose approximately 72% the excess weight. The duration of the surgery is 1 hour approximately. The hospital 2 nights and recovery 1 to 3 weeks. It depends what is your job. Next, please. The other option is the gastric sleeve endoscopic. This is the same, but the difference is in this case, I don't do incisions. Only the all procedure is endoscopic. It's a procedure reversible in compared with the gastric sleeve laparoscopic. Reduce complication. The rate is less 1%. The recovery time is very short, approximately 3 days. You can lose the excess weight approximately 40%. The duration during the surgery is 30 minutes. The hospital is only 1 night, and recovery is similar to the gastric sleeve laparoscopy, 1 to 3 weeks, maybe less, 2 weeks. Next, please. The most important surgery when talk about the obesity is the gastric bypass, R and Y. The gastric bypass, I form a new stomach. In this case, is a pouch gastric, while the remaining stomach stays in place. The small intestine are rerouted to bypass for digestion, which creates malabsorption and reduces calorie intake. The expectation is better in compared with the gastric sleeve. When the person have acid reflux, the best option is gastric bypass R and Y. Approximately 80% you can improve the comorbidities, for example, diabetes, high blood pressure, and sleep apnea. Approximately, you can lose excess weight 75%. The duration of surgery is 2 hours. is a little more in compared with the gastric sleeve. The hospital 3 nights and recovery time 2 to 4 weeks. Next, please. The other option is mini gastric bypass. The results a long time is very similar to gastric bypass in RNY, but if you have acid reflux, it's better gastric bypass RNY. But in this case, mini gastric bypass is better, for example, in person with have super obesity. This is my 50 or more BMI. What is the expectations? Reduces the feeling of hunger through the altered gut. Is the same in compared with the gastric bypass and RNY. Approximately, you can resolve diabetes type 2 in 80%, and it's the same in the have high blood pressure. What is the pros in compared with the gastric bypass RNY? In this case, bypass, I only do one anastomosis. This is a connection with the stomach, with the intestine. It's more safe, is very effective, and is procedure shorter in compared with the gastric bypass RNY. What is the duration in the operating room? It's approximately 2 hours. It's the same gastric bypass conventional. The hospital 3 nights is the same. In recovery time is 2 to 4 weeks approximately. Next, please. What is the best surgery for you? If you have BMI 35 to 55, I recommend you the best option is a gastric bypass RNY. But if you have acid reflux, it's better gastric bypass RNY in compared with the mini gastric bypass. But I can obtain mini gastric bypass too, but it's better the RNY. In question of related. In related with the time is more shorter mini gastric bypass in compared with the gastric bypass. Two options in this procedure really are good for you. Is really good option. Next, please. Other surgery less common is a duodenal switch. It's a really good option in patients with a super obesity. It's a more complex, but it's really a good opportunity when you have obesity and you take many medicine for that. You can weight lose approximately 80% after 1 year with this procedure. It's more complex. For the duration is approximately 3 to 4 hours. The hospital nights, 3 nights is the same. The gastric bypass, and recovery is more time, approximately 6 weeks, because it's a more complex procedure.
Okay. Where was here? Okay. All right, so let me see. So one thing, I guess if you can go over, which I couldn't find the slide for, is the difference between sleeve and bypass. That's a question, and a lot of people ask, what's the best option for me, sleeve or bypass?
In gastric sleeve, only I cut the stomach, approximately 80%. And the gastric bypass, I cut the stomach. I create a new stomach, approximately 4 centimeters. And then I do one connection with the intestine. This is a difference. In the sleeve, only cut the stomach, and the gastric bypass, I use the intestine too. Is a principal, is a main difference.
But who would you say needs to get a bypass and not get sleeve?
The gastric sleeve is more common for people who have BMI low, approximately 30 to 45 of BMI, and the gastric bypass is better for person who have BMI high, or maybe the patient have a reflux or other diseases. For example, obesity, diabetes, or blood pressure.
Okay. So one thing that we've been doing since pandemic is we are recommending you wear masks, and of course social distancing, and we do not require for you to do a PCR test or any kind of test before you come, but we highly recommend that. Please at least do the at-home test before you come for yourself and your companion. And of course, vaccination, boosters is always going to help. This one also, I'm going to ask Dr. Ceja to go over this one, which is one of the most question asked, is what is the recovery like after each procedure? Like how long can I, how long it takes before I lift weight or swim or do heavy duty exercise? Yeah. If you can please cover that.
Yeah. Okay. For it depends. What do you do? For example, if you have a gastric sleeve, you can go to work in maybe one week if your work is only the office. But if you have other heavy activity, maybe you can you can wait longer, maybe 1 month. But the most common is approximately 1 to 2 weeks. Is it similar in the other procedures, because the surgery is laparoscopic. The incision is very small, and you can do others activity the same if you have gastric sleeve, gastric bypass, or duodenal switch. The difference is the complex of procedure, but you can will go to work in the same time.
Okay, very good. So just touch on the financing. We do have several options. One of our options is Super Money. There is a link that comes from our website and our email that you can go there and apply. E-financing, United Medical Credit, well, they call themselves United Credit right now, and Medicard for Canadians. Of course, there are other channels, but Super Money is good because it covers a bunch of SoFi and those personal loan companies. One thing I need to make sure you don't apply for so many of these loans at the same time, maybe one or two, because once you apply for so many, it's going to hit your credit and then you won't be able to get a loan. Another option that has been a great game changer is what we call medical tourism insurance, MTI. And we have worked with the top provider of this insurance, which is GPS, to provide a highly discounted package that you are eligible to get once you sign up with us, which covers for procedure complications, travel, accommodation, emergency medical transportation, and a bunch of other additional coverage that you will see when you sign up. It's only $198. I recommend everyone to opt in for this, as is a great investment for just peace of mind. You're going to another country and getting procedures. So it's always good to have something that you won't use than looking for something you don't have. Now we're going to turn into question and answers. Thank you, Dr. Ceja, to be going over things quickly. Let's go back to all the question and answers. Okay, one of the questions they've been asking is switching surgeon. So if you have you're already in our system, you don't have to worry. We can always switch your surgeon, move you around. But one thing you need to know is this drawing today, the raffle, is for Dr. Ceja only, and it's the procedures that he performs. So if you have signed up or already paid for the procedure to get it through another surgeon for a different procedure Dr. Ceja doesn't provide, that's not going to apply. But if you are if you're willing to switch, then your name is in our system, no worries. One thing I'm asking you, Dr. Ceja, is do you perform mini gastric sleeve?
Yes, I do mini gastric sleeve, but it's a very selection because it's a really surgery only BMI really low. For example, 30 BMI. But I do mini gastric sleeve.
So we want you to, when you leave Mexico, we want you to be able to go to your destination. And if you're flying and it's long, please make sure you get up and walk around every hour. Wear the compression socks. And same thing with driving. If you're driving maybe 10 hours, you can stop more often. And also there's an option to stay one extra night, whether you stay in Tijuana, extra 1 or 2 nights, or in San Diego, which is beautiful. You can really enjoy your stay. So either way, take a little longer before you fly long distance or you drive long distance. They're asking what is the BMI requirement for ESG or endo sleep?
The BMI for gastric sleeve topic is 30 to 35 of BMI. Is more recommended this BMI.
Okay, thank
If
you.
more is better, a gastric sleeve conventional, regular, or gastric bypass.
Says, what if I have a lower BMI, like BMI of 33, but also have GERD? What's the procedure for me?
Lower, for example, less 30. The best option is maybe gastric balloon or...
No, this is a BMI of 33, but they do have reflux. They do a GERD problem.
Oh, okay. The best option in this case is a gastric bypass. If you have 33 and acid reflux, the best gastric bypass are in white.
Okay, perfect. If I want to do a gastric sleep, I don't want. So just one thing I want to make sure, we don't do open surgery, open incision surgery. All of our procedures are laparoscopic or endoscopic. And then laparoscopic is a tiny incision. So they're asking about the MTI, which is the medical tourism insurance. So when you purchase the medical tourism insurance, is basically if you run into problems, complication or travel related problems, you go ahead and pay, and then you file a claim and they would reimburse you. Of course, you know, it has to be legitimate, but also if for example, if this is like a major issue, then you actually talk to them and they would take over the hospital bills and everything else. But in general, it would be just a simple paying out of pocket and then getting reimbursed by filing a claim. For gastric sleeve, usually our surgeons do 3 to 5 incisions. Some do 3, depends. But you could also get a single incision if your BMI is lower than 40. I was just trying to put this the difference between the tube type. Yeah, like Dr. Ceja mentioned, mini sleeve is only for limited BMI and is very specific.
Yeah.
It's not like full-blown gastric sleeve or VSG. Okay. They're asking about the price. So our prices for gastric sleeve all-inclusive packages, it starts at $45.95, and it goes up based on which surgeon you choose. So this patient is asking, if I have frequent heartburn, is gastric bypass is the only option, or I can get mini gastric bypass?
The best option is gastric bypass RNY, but you can obtain the mini gastric bypass, but it's important check during the surgery the stomach, because maybe the patient can puede tener cáncer. Puede tener una hernia.
he can have.
Okay, maybe she can have a hiatal hernia and is necessary repair during the surgery. But yes,
It's also possible.
it's possible obtain a mini gastric bypass.
Okay, one thing about the travel related questions. So we want you to be at San Diego International Airport, whether you fly or you drive. That's where we pick you up, and then we bring you back to the same area. So if you want to drive, you can park your car around the airport and go to the airport to get picked up. Of course, our driver calls you the day before your departure and make sure you guys are connected to each other. You know where to wait and how to get picked up. As far as some very seldom patients actually drive to Tijuana to the hospital, but that's another option. This is another question for you, Dr. Ceja. They're asking, is it okay to have this procedure if you take opioids?
Yes, you can take this procedure, but it's necessary before surgery. You take other medicine for the when the person take opioids, because is more complex after surgery. Control the pain with in this case, but it's possible.
Yes. As far as the follow-ups, you really don't have much of follow-ups to do. So basically, we recommend that when you come back after 3 months, you do a blood test to make sure all your vitamins and vitals are checking. And then after that, just go through your regular checkups. And there's nothing really to worry about. It's not like lap band that you have to maintain it or refill it or adjust the filling. So we don't require COVID shots before you travel. So do you give blood thinners to patients that are high risk for blood clots?
Yes, I prescribe the
Blood thinners.
Blood thinners when the patient have a high risk for blood clots. Yes, it depends the BMI, but almost is necessary. Maybe if the patient have 50 BMI, 14 days after surgery, he takes the blood thinner.
Is there any food restrictions after gastric sleeve?
The first months after surgery, gastric sleeve or gastric bypass, exists a restrictive diet, but after maybe 6 months, you can take practically all food, but in a small portions.
Now, if the surgeon finds out that you need like hiatal hernia or anything like that during the procedure, they do perform it because it's necessary, and we just charge you the extra. For example, for hernia repair, I think it's about 395 or 350. I'm not sure, but it's very minimal. But it's necessary for you to get that performed and get it cleared so you won't have acid reflux problems. So we normally suggest that you don't have babies after 1.5 years after procedure. As far as the companion, you're welcome to bring a companion. Over 50% of our patients come alone, and however, if you bring a companion, they could do a visit with you at the hospital, but they can't stay overnight. And they would be staying behind in the hotel while you're in the hospital. So what is the ideal procedure? This is for you, Dr. Ceja. What is the ideal procedure for PCOS?
The best procedure, the gold standard procedure is gastric bypass RNY.
So this patient also, this is your question again. They're asking, I'm trying to decide between bypass, RNY bypass, and duodenal switch. Which option is better for me? I weigh 365 pounds. And I've seen patients lose more weight with the duodenal switch.
Definitely the best option for, in this case, do the BMI is duodenal switch, because you the patient can more weight loss, but the gastric bypass is the best option in the obesity or morbid obesity, because it's the gold standard for obesity, and the majority of patients have acid reflux, and it's better the gastric bypass RNY, but is the results a long time is very similar. I like I like more the gastric bypass RNY, but is the two procedures is a good option.
This is a good time for me to go over another aspect of the procedure. Of course, you know, I would like to share with you these before after pictures that are, let's see. We do have thousands of these pictures from our past patients, their success that as they share on their Facebook support group. However, one of the components of long-term success for this procedure is taking proper diet and taking proper nutrition and vitamins, especially for bypass. Even gastric sleeve, at least 1.5 to 2 years into the procedure, you want to make sure you take the bariatric vitamins. And bariatric vitamins are made specifically for patients who have gone through the procedure, and they're not like the over-the-counter multivitamin, and it comes in soft chew, chewable, drinkable, and capsules. Make sure you subscribe to emergebariatrics.com and take these vitamins after the procedure. Okay, well, I think that we have pretty much covered majority of the questions, and because we promised to not exceed our 1 hour limit for 45 minutes to 1 hour. So I appreciate Dr. Ceja to be with us today and kindly answer all the questions. Thank you so much. We appreciate you. And I'm going to announce the winner of this webinar. Just a moment here. Again, the only requirement was filling out the health questionnaire and be present to the end of the end of our presentation. Wendy Kirkland, I'm going to let you talk and share your story and your success. I want to congratulate you first of all for being the winner of our $2,000 off of procedure raffle. Are you there to talk?
Yes, I am.
Hi, Wendy. How are you?
Good.
Congratulations.
Thank you.
You're welcome. So tell us about your story. What is your, where do you live? What's your BMI? And did you sign up already or not?
I live in New Mexico
Okay,
and my BMI is around 46.
okay,
And I haven't signed up yet. I did the health questionnaire and everything. I haven't signed up yet because I'm not
Okay.
actually wanting to have the surgery until June.
okay.
I work for a school here, so I'm waiting for school to be out for the year for the summer.
I see. Okay, well, still you may want to talk to our coordinators. They're probably going to contact you because I'm going to let them know who the winner is and make sure you're being taken care of. And then, of course, you know, whenever you're ready, I understand that you have time off in June. So hopefully we see you down there. And I want to thank Dr. Ceja again, and thank every one of you for joining us and tuning to our presentation. We see you after Thanksgiving in December. Thank you so much. Goodbye.